This is Dr. Gombera with Fondren Orthopedic Group, presenting a hip arthroscopy and labrum repair for a labral tear caused by hip impingement and FAI. This is what the completed labral repair looks like after we had placed 3 suture anchors for the repair. Once the labral tear has been identified, we prepare the rim of the acetabulum and we start placing a 1.6 millimeter all suture based suture anchor. We start in the anterior portion of the hip and then work towards the superior portion of the hip to complete the repair. After the anchor is placed, I use a low profile suture passer to pass the suture around the labrum itself, aiming for the junction of the labrum and the cartilage surface. There are multiple suture configurations that can be used. The most reliable one that I've used is a cinch type or luggage tag type suture. This particular suture configuration prepares the labrum well in an anatomic configuration without changing the placement or the mechanics of the labrum itself. I typically space the suture anchors 5 to 7 millimeters apart. Thus, the number of anchors used depends on how large or how wide the labral tear is. A typical labral repair utilizes 2 to 3 suture anchors. Occasionally we'll use as few as 1 or as many as 5 suture anchors to properly repair the labrum. The tissue quality of this particular labral repair is excellent. In cases where the tissue quality is not good, or a prior labral repair has been performed, or a significant debridement has been performed, where there's no remaining good tissue quality, then a labral reconstruction might need to be performed in certain cases. After we've tied the last suture anchor, we now reevaluate the labrum to show the completed labral repair and restoration of labral stability. Thank you.